Today I'm going to address a very important question which most of our patients ask. Is cancer 100% curable? Hello all, I'm Dr. Vishwanath, consultant medical oncologist at Apollo Hospitals, Bangalore. So this is a very broad question and it is in fact a spectrum. So there are certain curable cancers. I would start with that. So there is something called chronic myeloid leukemia, which is a type of blood cancer. In most situations, with a simple oral pill, which came into existence in 1996, this particular oral pill has cured, or the patients have near normal lifespan in most situations. And it's just one oral pill a day. And most of these individuals end up getting cured, and this is called chronic myeloid leukemia. And there are certain early stage solid cancers, which I call them as, like early breast cancer, especially the good subtype ones which are hormone receptor positive, and then the early stage colon cancer. So all these kind of patients with the right kind of treatment like surgery plus or minus chemotherapy, and in early breast cancer we also give them hormonal therapy after the chemo and radiation. So in a large majority of individuals, these cancers are, I wouldn't say curable, but they end up having almost a normal lifespan, and the chances of recurrence is quite low. There's another type of blood cancer which is called as lymphoma, which is also called the cancer of the lymph nodes. There are two types of lymphomas. There's Hodgkin and non-Hodgkin. And Hodgkin lymphoma, in most situations, in 80 to 90% of them, it is curable with the conventional chemotherapy. And now we have wonderful targeted therapies as well, which has kind of augmented the overall survival of these individuals. And in a large majority of them, it is curable. The other type of lymphoma is the non-Hodgkin lymphoma. Again, there are two broad subtypes of non-Hodgkin lymphoma. There's something called B cell lymphoma and T cell lymphoma. B cell lymphomas, there are again some high grade ones. In a large majority of them, these high grade ones, in the first 2 years with the conventional chemotherapy, if the disease does not come back, they end up getting cured. So these are the curable cancers, I would say. But again, there are certain other early stage cancers which could be arising in different parts of the body. It all depends on the stage, and it also depends on the overall general condition of the patient and the patient profile, whether the patient is able to receive chemotherapy, how well he is able to tolerate. All these are factors which may determine extent of recurrence. We also talk about stage 4 cancers. Stage 4 cancers, most of them are not, I would say, they are not curable at all. In fact, in 100% of them, it is not curable. But we are able to significantly extend the lifespan and quality of life in these individuals. Now, I will take an example of hormone receptor positive advanced breast cancer. Now, this is the best subset of breast cancer. Even if a lady has been diagnosed with stage 4 breast cancer with hormone receptor positivity, we have wonderful targeted therapies, and with that, patients are living close to almost 8 to 10 years, and they are having excellent quality of life, and it is probably becoming the new diabetes and hypertension. We have transformed these cancers which were once having very dismal survival of 3 to 6 months to several years. So it is not cure, but at some point in time, maybe in the next few years, we may inch towards cure in these kind of very good subset of stage 4 cancers as well. And it is exciting times to be in medical oncology, because these patients are living long and we are able to improve their quality of life as well.